Okay, let's go ahead and get started. OCO, welcome everyone to Inclusivity in Action, Indigenous Veteran Oral Health and Wellbeing webinar. My name is Julie Seward. I'm a citizen of the Cherokee Nation, Oklahoma, a registered dental hygienist, and the Oral Health Programs Manager at the Southern Plains Tribal Health Board, where I have the privilege of facilitating the work happening through the Native Oral Health Network. So Wado to all of you for being here with us this Friday afternoon, or perhaps morning for some of you guys. You know where all everyone is joining us from. This has been a productive week of sharing information and connecting with new partners in this work. And what a way to acknowledge and celebrate Native American Heritage Month by sharing this space with you all to honor our Indigenous veterans through engaging in a shared learning experience to understand the problems and discuss how we can do better. To get us started, if you'd put, oh, I saw Grace is already on that. Fantastic. So I'm seeing names and places in the chat box. So perfect. Okay, next slide. Okay, thank you. The Native Oral Health Network is a program housed at the Southern Plains Tribal Health Board, Oklahoma Tribal Epidemiology Center. It's a mouthful. The Southern Plains Tribal Health Board is a nonprofit organization based in Oklahoma City, Oklahoma. The health board, which is one of 11 area health boards across the nation, was established in 1972 to provide a unified voice on tribal public health needs and policy for the 44 federally recognized tribes located in Oklahoma, Kansas, and Texas. NON's mission, NON Native Oral Health Network, and NON's mission is to build healthier Native communities by connecting oral health to overall health, and overall health and wellness, through peer support, collaboration, and community engagement. We work with other area health boards, tribal epidemiology centers, dental support centers, and other public health partners to advance oral health equity. Slide. I want to thank the entire team first at the American Institute of Dental Public Health for their partnership in raising awareness of the intersection of veteran and Indigenous oral health throughout this week, and for being an accomplice, as Annalise has said before, that I love that term, being an accomplice in our efforts towards achieving oral health equity. And so with that, I want to hand it over to Annalise Cothran with AIDPH.
Thank you, Julie. Hi, everyone. Welcome. We are so excited that you're here today. And we are so pleased to be able to partner with Southern Plains Tribal Health Board and the Native Oral Health Network to present this week and also this webinar today. So AIDPH, in our work to pursue a justice-oriented oral health care system, we focus on 4 core communities that include LGBTQIA+ people, people living with disabilities, people living in rural areas, and veterans. So we're very excited to be able to expand our work and our focus on veterans this week in partnership with Julie and her team. And this very much follows our community engaged approach, where we really want to build authentic relationships with communities who often experience historical exclusion from healthcare systems, and with the intention of creating initiatives and research and educational frameworks that directly benefit those communities with communities and leadership. So AIDPH is very pleased to be able to support this work and this week's initiatives. Just a little bit of housekeeping. Please add your personal pronouns to your display name. If you are able to do that, you can hover over your video box and press the 3 little buttons at the top and click rename. Please stay muted throughout today, although we will have some Q&A at the end. You can also add questions and comments through the chat. Julie, who will be moderating today's session, will be able to pick up on those, and will also be there to respond in the comments section too. This session is being recorded, and we will make all of this information available after. So if you have to hop off halfway through, that's okay. You'll still be able to get the information from our wonderful panelists joining us today. We have no disclosures. Here are the learning objectives. And Julie has already hinted at this in her comments earlier. But the reason why we're doing this today is because many Indigenous people have served in the United States Armed Forces. And unfortunately, they are overlooked, underserved, and underconsidered when we're talking about veterans as a population, despite them being the largest demographic group per capita among veterans. So this is why we're focused on Indigenous veteran oral health this week, because Indigenous veterans are an important piece of the veteran community, and the cultural responsiveness that we should all come to the table with to support them and their oral health is often underconsidered. So through today's discussion, the 4 highlights that we'll be covering include understanding Indigenous service and representation, disparities in oral health and access to care, culturally responsive care, and mobilizing action and advocacy. And so with that, I would like to turn it over to our panelists to introduce themselves.
Okay, I'll get started. Pivishe, Rachel Kimbrough, na ostone, na natistas na ka na su. Good afternoon. My name is Rachel Kimbrough. My Cheyenne name is Planting Woman. I come from the Cheyenne Arapaho tribes, but just Cheyenne. And I'm also Ka and Sioux. And I just want to start with, I'm currently a senior at the University of Central Oklahoma studying public health. And I currently serve on my Cheyenne Arapaho Tribes Veterans Board. I have 3 daughters, A-Marie, Margot, and Issa. And also my husband is a Master Sergeant in the Air Force, serving at Tinker Air Force Base in Oklahoma. I spent nearly 11 years in the Air Force as a services airman. I've been stationed in South Dakota for 6 years, and I was also in South Korea, United Kingdom, and we actually got orders to here from Germany. I completed 3 deployments overseas, supporting Operation Enduring Freedom and Inherent Resolve. Also, my time in the military, coming back here to Oklahoma, luckily we got orders here, so I've been really focused on reconnecting with my family because I was overseas for about 6 years out of my 11. So it feels real good to get back with my culture and my ceremonies. And also just pursuing my education and being a stay-at-home mom. And I think that's it. So thank you for this opportunity just to also hear all of you professionals share your knowledge. And that's it. Ho-ho.
Thanks for that, Rachel. My name is Bernice Jordan, UP Jordan. I currently work in the Tribal Health Program Support Department for the United South and Eastern Tribes. I work closely with member tribal nations in development and managing effective public health programs and projects. I participate in tribal community and tribal public information efforts of initiated projects, including community-based participatory activities. I currently work on the opioid overdose and new overdose prevention in tribal communities project, integrative community health in tribal communities, USET opioid task force, and the reclaiming native psychological brilliance in tribal communities. Also, I am an active member of the USET's Veteran Committee. Within USET, we have 33 tribal nations, so it is very nice to work with not just one tribal nation, but a multitude of them. I am an Army combat veteran with almost 15 years of combined service, and I am a member of the Fort Peck Sioux tribe in Montana. So hello, and thanks for today.
Thank you all for being here. Thank you for your service. I'm humbled and excited to be sharing this space with you all to learn of your experiences and hear of your perspectives in regards to access to oral health care. And so, as Annalise mentioned, earlier, we've got 4 topic areas that we're going to take a deeper dive into. So topic 1, understanding Indigenous veteran service and representation. So Bernice, I'm going to start with you, if that's okay. And so can you share some historical context about the contributions of Indigenous veterans to the United States, including their significant presence in the military and their distinguished service record?
Yeah, thanks for that, Julie. So as most people know, Native Americans have a long and complicated history in serving in the United States military. As most everybody knows, we do have a higher demographic than any other ethnicity in the entire country. One of the biggest factors, or one of the biggest reasons why we continue to serve in the United States military is because of the warrior. I guess I need to speak for myself, because I know there are other tribes within the United States that have different reasons for serving. But within mine, I know one of the biggest factors is the warrior spirit. And, just being able to continue on with, something that was instilled inside of us, being able to do that. So there have been a long tradition of written language, as we all know, that some of the Native American people have used throughout the history. And most common is the Navajo men, when they joined the Marine Corps, known as the code talkers. But then again, coming from that, those 400 Native code talkers in the military, there were not just Navajo, but there were Cherokee, Choctaw, Lakota, Comanche, and some other tribes as well, all translating encrypted messages in their native tongues from the front lines in real time as they have to receive them. Although Japanese forces were never able to break those codes, this code helped the United States win, the war. Today, Native American women not only serve, but also at a much higher rate than other demographics. Almost 20% of all Native American service members are women. In our modern U.S. military, we have carried on a tradition of service and sacrifice to this nation. So I will go ahead and end it there. I don't know if Rachel has anything, or I'll give it back to you, Julie.
Thank you so much for that, Bernice. And yeah, Rachel, do you have anything to add to that question?
Just more on learning. Well, like I said, while I was in the military, didn't quite go back home as often as I would have hoped, but I didn't understand how important my tribe, Cheyennes, how they were put such importance on our service. And we incorporate that in our ceremonies. We always acknowledge them anywhere we are, whether it's in the teepee or in our Sundance. So the warriors, both women and men, that's something that we hold to the highest. Just like my grandma would always say, after the Washita River massacre that happened, that's something the Cheyenne always honor, which is that flag. So that is something that we always hold dear to our hearts. And I'm just really, like I said, thankful that I came back home to understand that, because to me, I just thought I was serving, like I did my time and I'm out. But once I understood that part, it's all I wanted to do after is really let all the other service members and the veterans know how important they are and how much we need them to go out there and serve and come back and bring it back to our community. So I think that's, I'll leave it there, but thank you.
Thank you so much. So moving on to the next question, and I'm going to stay with you, Rachel, here for this one. What unique challenges and disparities do Indigenous veterans face in terms of income, education, employment compared to their non-Indigenous counterparts?
Well, as serving as part of the board, for us, it's that understanding, that education on what is available to us. As much as like when we're in the military, like as soon as we go in, we know, like when our next dental appointment is. We have to stand on a list to know when we're going to get our next immunization. Like they take care of us in that way. So it's like once we, become veterans and we're out back into the real world, it's the best way I can say it. We lack that education of knowing what our benefits are. Like, how can we take care of ourselves? Like right now, like for our veterans board, we're having issues with communicating to our veterans that, it's important to enroll into IHS and the VA hospital, so those two can take care of each other so they don't have to ever pay anything. But like, it just goes back to, most of us out here, and especially in the rural areas, sorry, it's just trusting the professionals that are trying to tell us what's good for us. Sometimes it takes a lot of us, like I said, the veterans who are going out there and coming back with that education, or just, that mindset of wanting to take care of them. It just goes a long way for them to, to get the right care they need, to have someone talk to them in a good way, because that's really important. It goes a long way. So yeah, I hope that answered your question. Sometimes I can go less. So, yeah,
I'm the same way. I can 100% relate. Yes, no, absolutely. So, you mentioned whenever, you're taking care of, when you said when you get back to the real world, right? And some of the struggles that you face. And so I want to add to that. I want to ask Bernice. So in particularly, among Indigenous veterans, the data says that there is a higher need for dental care, but a struggle to access it. Could you talk a little bit and maybe build on what Rachel was talking about, on reasons behind the difficulty in accessing dental care?
Yeah, so some of the things that Rachel said really resonated with me, especially with the rural areas, because that access to care is really hard for many. As she spoke about, being in the military, you have those appointments, you have that access to care within reach. When you're in a rural area where most of our reservations are located, it's really hard for many reasons. You don't have a dentist there. You don't have dental clinics. You might need specialty care. You don't have the funds to drive to get, that specialty care. Although you have co-payments and things from the IHS, there's still other factors, other monetary things that you would have to pay for. Sometimes you don't even have a vehicle to drive. So there are those things. And depending on what era you have lived in, there's that trust factor as well. A lot of times when it comes to education, I was just thinking about, as a kid, I remember going into school and getting some, checkups at school. The dental office would come in. Didn't really know why we were doing it, just knew we were standing in a line and kind of sitting down and getting some fluoride. And I just remember, we will always remember what the taste of that fluoride. But thinking about those things, not really knowing what you're doing and just kind of following suit. And that's what really happened traditionally or historically within the Native American. So told to do something, cut hair, boarding school era, taken away, language, all these other factors. So there is that huge trust factor there. And I think that really is a big part of, why some do not have better, healthcare when it comes to the oral healthcare.
Yeah, absolutely. And so much of this week, and the information that we've shared and some of the resources and information going out is the importance of culturally responsive care and having those environments and having the trust established and how important it is. So my next question is, how do you feel that the Indian healthcare or the healthcare delivery system for Indigenous populations kind of encapsulated in the ITU system, which is IHS clinics, tribally ran facilities, or urban Indian clinics? How does this healthcare delivery system and the lack of culturally responsive care environments contribute to these disparities among veterans? And really, where do opportunities exist for real systemic change in this care delivery system?
So culturally responsive care, I was thinking, there's training that so many are familiar with or needing to be trained within, cultural humility training or culturally responsive training. And that's, just educating yourself on the people and how to treat, the patients in that way. Sometimes, it's familiarity or just being able to communicate with the Native population. You were talking about IHS healthcare and, how if that was easily accessible within, the areas, rural areas. I could tell you where I grew up, we did not, to this day, there is no dentist there. There are people that do come in at times, but it's a shortage. There's really a limitation and a shortage of dental care. I know I have a friend of mine. She recently does a mobile clinic, and she's able to go ahead and get out to some of these rural areas, which is very appreciated, because there have been years where that wasn't established. Now there is programs such as HPDP and things that help out with some of the dental efforts. So it's really just how much is your region, how informed or how much are they willing to invest in that oral healthcare or some of the other healthcare that we do have. I think I'm not sure what the other questions that you had were, but I know there was plenty, and I could.
It was a loaded question. Yeah, it was loaded. There was a lot. There's a lot of layers to peel back from that one. So yeah. Absolutely. But I think, so often, especially, in the space that we work in, we talk about the inequities and the disparities and the need. And I feel like there's such an opportunity to talk about the strengths and the innovations and the progress and the opportunities to create meaningful change and to really highlight and showcase the wonderful work that tribes and tribal communities are doing to serve their people. So, what are some of those opportunities that we can, I will say, on this call as partners or as accomplices in this work towards oral health equity? What are some opportunities exist for us to work together and to partner to increase culturally responsive care awareness and provide that education to non-Indigenous organizations and entities? And I'll throw that up there, whoever wants to grab that one.
Yeah, I'll take the first go. So I think a good example that we actually came across in our Veterans Board recently is one of my grandpa's, Larry Romanos. He went out to Denver, out in I think it was the Denver Metro IHS, but they encouraged all of the employees, IHS employees, to help build a sweat, and then also, go in there and sweat with some of the elders and some of the veterans that were there. And our board was kind of taken back. We're like, how did it go? And Larry my grandpa was telling me that it went really well. Like, a lot of them were like really encouraged and thanked him for allowing them to step in and pray with them. And for us, we're like, we really want to do that here in Oklahoma, like with the surrounding tribes, and also just like the Clinton IHS, the ones that are more local to us in our 6th service area. So I think that was like one thing we were really encouraging, but also like when we have events like almost all the time, our tribe, like we had an elder conference not too long ago. And we always have like these opportunities for people to set up tables and talk with everyone who, shows up. But what I noticed is like this last conference we had, like we didn't have any, one really like talking about dental care, and also it's just like I said, like it's really important just to talk with them, like one of the things I've always noticed is that like I can get through, especially to my elders, because they already have like an idea of like how things are, and that's the way it is. So, for me, I always like to hear their stories first, and that's just how we are. Like, we listen to them and we wait to talk, like we don't talk over them. Not everything requires a response. It's just kind of how we are. But once I hear everything they have to say, then it's like, I just want to tell you, like, this is important for you to go to IHS, like, let us know how you can get there. Like, just hearing what their concerns are and their stories, and then get to that point of how can we help you? And then what, like, this is what we have to help you, just kind of moving forward, because that's just kind of how it is. And even with my, myself, I'm just in my 30s. So even with all, the age differences, we all still kind of culturally know how to talk to each other. Like there's a lot of ceremonial men that, we can't say certain things to. So there's a lot of things that you just have to be mindful of when you speak to different people. But it's always also just that thing of just having that mutual respect and hearing what they have to say before you approach them with anything that can help them.
I think that's, all those points, Rachel, are very good, thinking about cultural competency, because, a lot of us have been brought up with grandparents and, in the cultural aspect and, on reservations. But we do have a majority of our Native people do live in the urban areas. So they don't have the same upbringing as we, some of us have had. And I say that because there could be a difference when it comes to the way things are handled in that sense, as far as elders and being able to do the traditions and customs and things that we have, compared to what others are seeing out there, and also that just kind of thinking about the access to healthcare too. There's differences there. When it comes to that, there are big urban health centers within, I can think of a few. I could think of LA, Minnesota, Seattle, New York. I really don't know about the southern area, the southern region over, past Nashville on down. And that was one idea that we came across one day is, what about the natives that live in this area? What do they have as far as, the urban healthcare settings, and not being, closely tied to their tribal area. So there's that.
While we're kind of talking about this, I want to ask a question from the chat, actually from Annalise, AIDPH. So she says, I love how you brought up asset-based approaches to culturally responsive care for Indigenous veterans. Are there any frameworks we can consider for those asset-based approaches as oral health professionals?
I think just continuing on with, I'm thinking of frameworks and asset-based approaches. I think education is always a huge piece, no matter what, and also making sure that your staff are, have cultural competency training or cultural humility training when you're trying to create a program or get involved with the Indigenous communities. I also would think, because we would love for these communities, for our communities to be sovereign, and that's just something that we have always wanted, and that's just letting them plan out their own programs and things when it comes to that. So those types of things, I think, just becoming familiar with that and continuing to just educate yourself on that cultural elder respect as well.
Absolutely. And Rachel, you were talking about this earlier, and I want to address another question from the chat too before we move on to the next topic. So, you talked about trust building, you talked about the importance of listening, Indigenous cultures, listening to elders and waiting to see, you mentioned those things, and those are all very important in building trust. The question is, how do we as non-Indigenous organizations increase trust?
I think one of the first things I was thinking about was, I really like how Bernice said that part about like all of the natives in the urban areas, because those are the ones that was me growing up, and that's my mom. That's a lot of people that aren't connected to their tribes. One thing I always notice is that my mom, even though she didn't know any of her, her cultural ways, like she knew that, oh, there is an IHS over here in this area that I can go to. But, it's just like we were talking about before, is like not having a ride, those things. She was a single mom. So, I think about her all the time. And also I think about what I'm learning now. Like I said, I was in the military for 11 years. And before that, I was one of those urban natives. I didn't know anything. And coming back and actually like getting to know all of my relatives and really just like on that standpoint of veterans is understanding that that trust part, and especially in those rural areas, like it's kind of and especially with the VA system, really hearing them out, because for a long time, well, I'm not going to say for a long time, but for a certain period of time, the Clinton VA hospital had some issues with our Cheyenne and Arapaho members out that way, and it caused a lot of them to just stay away. They didn't want to get the care, but now things are getting a lot better. And like we just met with a public health officer a couple of months ago, and he sat down with us and he was answering any questions we had. And just to see that, he's not native, but he made that time to come sit down with us and talk to us about any like concerns, any stories we had to share about ourselves. And he was open. And I like, we're taken back by that, because most times it's just like, he always met with everybody above us, like in our tribe. And for him to sit down with just us as veterans, we're real humble people. So, we just really are just like listening to them. And I think it's just that part, it goes a long way, for someone just to hear a person's story and then apply like how I can help you. Like I've noticed that just as like my approach in the military, like I learned a lot, and I apply that to everything that I do as well. So what I notice is that I can get really just structured and then I feel like things are a certain way. And then I go with my family and everyone in my community, and it's not that way. So I feel like I'm bossy or like I say too much. So I have to scale back with my approaches and really just kind of be in their elements of how they are. And I think that's just knowing your environment, knowing your people, because those people, all they want to do is just sit there and let you know how they're doing, what their problems are, like, you know, and how can we help you. Just hearing that is powerful. And like I said, that's just how we are as Cheyenne people and just Native people. We just like to talk and then give that respect. And like I said, I think that's just a main part of starting that conversation with people in those communities.
Absolutely. And, you know, and stories are so powerful and such an important way to communicate needs and really to build trust. And we're talking about how to build trust within Indigenous communities. And so I do, you know, we invite everyone to if you have any with our attendees on the call, you know, there are opportunities to share those stories and to add to any of the conversation that we've had so far today. And thank you, Grace, for putting that link in the chat to share your story with us. So I want to, as we start to kind of wrap up, looking at the time, we've got maybe time for a couple more questions. So, you know, we've talked a lot about culturally responsive care. And so as advocates, as, you know, our colleagues in public health and our colleagues in oral health and oral health equity, how can advocacy play in ensuring that culturally responsive care, that cultural humility trainings become the standard in oral health for Indigenous veterans?
I think that training is very important. And I think, you know, just looking for that person, reaching out within your Native network to see who teaches that training, because there's so many that teach in a different way. And you know, it's becoming, it's huge within our Native communities, you know, in order to get trained, because not only are you dealing with the Native patients or Native community, you also have the providers that are non-Native, and they really need that, you know, just offer that sense of training and perspective on how to relate. I know Rachel made you know, some good points about, you know, the relationships and things like that, how you meet people where they're at and how you talk with people. But really, you know, one of the best examples I heard was somebody just approaching one of the providers approaching a patient and just saying, you know, just kind of talking to them and say, you know, what family are you from, you know, and just, you know, a little bit of history, a little bit of story about you, really invested in you, so they know that you care. And once, you know, you establish that, then, you know, you'll see how much that person will actually open up to you. There might be something little as, you know, I bead, or, you know, my family is known for making star quilts or fry bread, you know, that's our favorite one, you know, we have the best fry bread. But whatever the case is, it's always good to just have that relationship with them and start that building that trust mechanism first. And that goes a long way with, you know, and I don't want to say with just the Native community, but for any person, I believe, you know, just having that sit down, we are real people conversation.
Mm-hmm.
So there's that.
Okay, Rachel, did you want to add in anything to that?
Yeah, actually, I like what Bernice said. I really appreciate Bernice talking first, just because, I'm still a student, and I just want to let you guys know that I'm still learning a lot. So I appreciate her really just taking that taking that role. So thank you for that. But I like that part. I don't know if I understood it right, but just like providers actually giving training to other members in the tribe to actually communicate to our tribal members. I have talked to a lot of friends and relatives who work at the tribe. And I think someone was telling me one time, she was like, I've learned how to do all of the stuff in the office. And she was like, I have some good ideas to like take out to our people. She was like, but I'm not certified to do this. I'm not certified to do that. But like, I have that common knowledge to like go out and talk to people. And, and I think that like, that will actually help too, encouraging the people that are actually in those communities on a day-to-day basis, and going to those powwows and those benefit dances and all those places where they are and sitting at a table, or just gaining that common knowledge to communicate to everybody else. I think it is really awesome, to empower our people to know that knowledge and say, hey, like a provider taught me something that I can give back to you guys. Like, this is important, something I learned. Yeah, so I really liked, I don't know if that was said, but I really like that idea.
Yeah, absolutely. I agree. Thank you for adding that, Rachel. Okay, so I think this is probably our last question. And so just to kind of culminate the week and this discussion, which has been fantastic. Again, just many, many thanks to you both for being here and sharing your perspectives and expertise. So this week has been aims and the goal of this oral health Indigenous Veteran Oral Health Awareness Week was to mobilize individuals and organizations and communities for action. So how can we sustain this into long-term improvements in oral health outcomes for Indigenous veterans? And how can we all support expanded access to care and support for larger oral health initiatives?
I feel like right now there are so many organizations out there trying to do that, trying to provide the expertise or knowledge or education or help create programs or even the funding sources that are currently in place to, help with these efforts. I feel like just really getting involved with those organizations, because I know frequently they reach out. There's, peer-to-peer sharing. There's different networks to be involved in. And I feel like that would be the best place to, start with these. And especially trying to come up with some sustainable activity. Once you get started, I know a lot of people have started, they started the planning phase, they started executing, and now how do we sustain it? Well, just continuing to, educate yourself or see what the new is. But, going back to that peer-to-peer discussion, seeing what others are doing across the country. And that's one good way to incorporate some of those other ideas that you didn't have. And then the new, there's a lot of new people that are in these roles now, as Rachel stated that she's in school right now, fresh new ideas that are coming about from the newly educated. These are also great ways to, kind of continue on with these services. So I think that that, should be empowered as well.
I think another thing too, I was talking to my uncle who's a veteran, Army. I asked him, I said, when's the last time you got any educational or just information about how important it is to go see a dentist on an annual basis? And he said, I don't know, it's been a long time. And I was like, oh, really? Okay. Well, for us, I'm thinking, like I said, that military mindset that I have, I know when people have great ideas, it's great. I said, but you have to put it into a standard, for me, like, and for it to stay long term, especially for our tribe. I always tell people, I'm like, let's ask that question in our intake forms. Like, are you being covered for medical care? All right, so do you see your doctor on an annual basis? Do you get an annual cleaning? Like, having those, like, just those small questions on asking our people, as much as we can, or, having those events, instilling that as a standard for their programs to ask those questions, because it can be a great program. And if that person is in charge of that program and it falls or anything, the interest just isn't there. I always feel like that's the best way to do it, but that's just me. But, I've noticed that, like, that's what we're trying to do too, is to incorporate, like, we actually had like a round table with all of our departments at our tribe, and we're like, hey, did you know we're doing this? Oh, you're doing that? Cool. Like, let's come together and put this in our intake forms and things. When we're helping this person with housing, like, come over to the veterans because we have HUD bash, like, we can help you incorporate, just come together, because communication and instilling those standards is really important. So yeah, so that's all I have.
I was just going to add to what Rachel said, and food. When you have these community events, Natives will come if you have food, me included.
It's if we provide food and then we lock the door and keep them in there. Yeah, that's what so I just want to say thank you both so much for your time and your knowledge sharing here. And I know this won't be the last time that we'll have an opportunity to connect and work together. So I really look forward to continued partnership through these important issues of Indigenous veteran health, overall health, oral health. So thank you all both so much. Okay, so we've got just a few minutes. We're going to wrap up and close with just a few announcements and shameless plugs for next upcoming events and opportunities to learn more, particularly for us, the Tribal Public Health Conference that the Southern Plains Tribal Health Board holds every year. This year, it will be April 23rd through the 25th at the Hard Rock Hotel and Casino in Tulsa, Oklahoma. Thank you, Grace, for putting that in the chat. You can go to spthb.org for more information. And I just want to fold in, some of the stuff that we were talking about earlier about Annalise, you mentioned community health workers and to keep the knowledge in the communities and train community members to provide, and that being a standard for culturally responsive care. And so at this conference, we'll be talking more about the Community Health Aid Program, which is just that. We'll be talking about how the Community Health Aid Program, the expansion from the Alaska tribes into the lower 48 states, is creating a new model of care and training to address the needs for tribal communities, that is for tribes and by tribes. So I wanted to mention that. Next slide. Also, the Native Oral Health Network, sign up, join us in this work. You can find the link there in the chat to become a member. And if you have best practices to share, tell us those so we can share those with our larger community here, and those that are wanting to work in advancing oral health equity for, again, targeting our Indigenous veterans. We have a bunch of other resources that you can find on our webpage, and then also follow us on our social media channels. So next slide. I believe the next one goes over to you, Annalise.
Thanks, Julie. And thank you so much, Bernice and Rachel. I really enjoyed hearing your insights. Again, learning from people with lived experience, I think, is the best kind of learning. And it's also, as Julie pointed out, a standard for culturally responsive care. So thank you all for honoring us with your stories and your presence here today. So we are offering CEUs for this session. If you would like to request CEUs, please fill out the form that Grace just put into the chat. Even if you're not requesting CEUs, we would love to hear your feedback on the evaluation. Julie and I will definitely read all of those comments and incorporate it so that our future sessions are better and more responsive to what folks want to hear and see. Just a couple of notes here for some upcoming programming that AIDPH has. Again, supporting veterans, AIDPH has been implementing a Veteran Oral Health Action Collaborative this year, and our final session is the connection between mental health and oral health. And we will have a presentation from Everyone for Veterans, which is a really wonderful multifactorial organization supporting veteran oral health and also mental health and social support. We have our ECHO session in just a few short days. And that topic is going to be on innovations in rural Indigenous veteran oral health. So as was already discussed today, there are a lot of tribal communities located in rural areas, and veterans live there too. And so we'll actually be hearing from folks who are from Indigenous veterans who are living in those rural areas and talking about their oral health care experiences. So please mark your calendars and join our session. Lastly, you may have heard throughout this week that AIDPH, through funding from PCORI, is starting an oral health community advisory board. And we are really seeking representation in all of our core areas of focus to include veterans. And we would love to have Indigenous people. If you feel like this is the appropriate opportunity for you to please consider the Oral Health Community Advisory Board. It's certainly not limited to veterans or LGBTQ or rural or Indigenous people. This is really an opportunity for us to be able to develop good research, and for the oral health community more broadly to be able to develop good research that is responsive to community need. And so we encourage you to consider that opportunity. There is a stipend available, and applications will be closing soon. Lastly, another shameless plug for our colloquium that will be held next year in Chicago. And it is based on, our topic is community collaboration to advance person-centered outcomes. We are very, very, very excited to be able to continue this theme on community engagement. And I know that all of you today are probably here because that's work you're already doing, or it's work that you're interested in. So we would love to have you present, attend, and otherwise support this endeavor. There are lots of opportunities for abstract submissions, and that can be with research, it can be education, advocacy, whatever frameworks that you're currently working in as it relates to community engagement. We really want to hear about that. So please consider an abstract. And if that's not a good fit, we hope that you'll be there at least to participate in person. And if you aren't able to participate, probably within a couple of months after, we'll make all of those sessions publicly available so that our broader community can always access all of that wonderful content. But the engagement piece is really important to be there in person. So we hope you'll consider it. And Julie, I'll hand it back to you to close us out today.
Okay, great. Thank you, Annalise. Thank you again to AIDPH for the partnership throughout this week. Thank you again to our panelists for the fantastic discussion. I know it's so easy when you hit that little red leave button on this webinar that we're automatically going to the next thing and continuing with our work in the broader sense. But we do encourage you to keep these reflections and the discussion in the back of your mind, in the front of your mind, somewhere in there, to continue to raise awareness of the things that we've talked about during our time together, promoting culturally responsive care and creating that standard, right, is partnering to create that standard to have culturally responsive care across the board. And again, to continue to advocate for improved oral health through all the ways that we've talked about this week. So I hope you all have a wonderful weekend. Thank you all for joining us, and we'll talk soon.